Thank you, Claire. That very much dovetails into what myself, Dr. Terri-Lynne South, and my co-presenter, nurse practitioner Catherine Smith is going to be talking about. Just a little introduction. I'm Terri-Lynne. I am a GP and I am the current chair of the RACGP specific interest in obesity management. I'll just talk first and then hand over to Catherine. As Claire said, we're eagerly awaiting these new guidelines. They are expected to be a valuable and essential tool in the implementation of the National Obesity Strategy and to guide clinical healthcare. But we cannot expect individuals and communities to start to address the challenge without guidance on the best evidence, standards, and options for people with obesity. There is a real risk that these eagerly awaited guidelines won't be used if they are not communicated, shared, and we need resources to be able to implement the recommendations. They need to be easy for the busy healthcare practitioner to implement. And we also need to understand that stigma is a major barrier for our patients living with obesity to access appropriate and needed care. And this does need to be considered in the development and dissemination of the guidelines, making sure we provide appropriate education resources and tools for healthcare practitioners. So we were asking, as part of our action, for the government to provide funding and support for healthcare professionals to be able to provide this quality care. We are asking that there is an official clarification and announcement that obesity as a chronic complex healthcare condition can and should be managed with current GP management and enhanced primary care plans, as well as eating disorder resources be available for people with binge eating disorder, which overlaps with obesity and is actually the most prevalent of eating disorders. Catherine, you have some ideas to share too.
Thank you, Terri-Lynne. Thank you for the opportunity to present on World Obesity Day. As a bariatric nurse practitioner working in this area of healthcare for the last 12 years, I'm so pleased to see the improvements our collaborations are getting traction with. Within clinical practice, we are seeing that patient-centred approach, not programs or one-size-fits-all services, are improving the health outcomes of our clients. When we consider our clients' experiences within the healthcare system and their community in their treatment, we are seeing improvements in well-being and health. Strengthening Medicare and the scope of practice reviews need to consider the barriers and potential health outcomes of a well-delivered bariatric healthcare, as these services can positively improve the health of our continually growing population of Australians with a weight issue. Nurse practitioner clinics, telehealth services, nurse-led clinics and allied health services are improving access to weight-related health services. My clinic, like many others, are working within the current barriers to achieve positive health outcomes, but our services could be much improved or increased considerably. My service has had a 330% growth in our client numbers in 2 years, with 76% of our clients self-referring. This is good to see that so many Australians are seeking services and having the faith that with us they can experience the improvements in their health. Telehealth may be considered a key part of this increased access. Nurse practitioners have the ability to support clients across wide areas of our country in which primary health care and specialty bariatric services are less accessible. Telehealth funding should be accessible to appropriate bariatric medical models for clients to access, as rural and remote Australians should not have their access limited by their geography. A certification process for all health practitioners working in bariatric healthcare, which acknowledges the training and continued education, is a requirement should be a requirement for specialty area, as we see in many other specialty fields. A well-delivered bariatric healthcare can be life-changing for Australians. Many of their stories are inspirational to us who have the honour of providing them their health care. We now have the ability to do this, so let us continue to grow these inspirational stories. Thanks, Terri-Lynne.
So in summary, we are asking for a whole of health approach, as is the standard of care for other chronic health conditions. For example, mental health, cardiovascular disease, and eating disorder. The same is required for obesity. These treatments are evidence-based and are supported by economic analysis. We are suggesting that there is an ethical imperative to urge people to not just lose weight, but to do so with the appropriate tools, evidence-based options, and referral pathways to do the request of asking people to lose weight without those supportive measures actually risks more harm than good, and the evidence shows that it's not effective. Our current approach is ineffective, inefficient, and wastes resources. We can do better. We must understand that stigma and that is perpetuated by not actually having evidence-based services and quality information available for people living with obesity. Thank you.